Welcome to the program. The rapid spread of COVID across Australia continued today, even in states that had once managed to keep the virus largely at bay. While New South Wales and Victoria continue to record the biggest daily case numbers, cases in other states that have managed to suppress numbers till now are rapidly accelerating. South Australia has recorded more than 3,000 cases today, while Queensland, which opened its border 3 weeks ago, recorded nearly 6,000. Even the ACT has nearly 1,000 cases. Despite this, the number of people in intensive care has still not followed the sharp upwards trend as yet. Deputy Chief Medical Officer Dr Sonia Bennett said today she expected cases to peak by February. But in the meantime, in addition to people getting sick, the sheer mechanics of confirming that you are carrying the disease seem to have only got worse. Long lines and hours-long waits continue at testing hubs, often for people who are feeling very, very ill, waiting for so-called PCR tests. The alternative spruiked by the Prime Minister last week as playing a much bigger role, rapid antigen tests, are almost impossible to find. The PM is also under increasing pressure over his hardline stance that people should pay for these tests themselves, with only some given out free at testing centres, but only for close contacts.
So if you turn up at those testing centres, for all the reasons that I've set out, then you will either get a rapid antigen test or a PCR test. If you're eligible for a rapid antigen test and there's ones there at that time, you'll be given one of those, you'll go home, you'll take it and follow those rules. Anyone else who would like to get a rapid antigen test, well, you go along to your pharmacy or to the supermarket or the warehouse, big suppliers. They can book their supplies, they can get them on the shelves and not have any concern that somehow a new policy will come in and tests will be handed out to anybody who wants one. It was agreed today that will not be the policy in Australia.
If you're a close contact or you're symptomatic, the tests are free. What's not free, of course, is where tests are used for other purposes, casual.
The PM's stand has attracted fierce criticism, even from some of his closest media supporters.
In the final stages of this pandemic, is he really going to pick this hill to die on? Like, politically, it defies logic. Those who just want a few for the medicine cupboard at home will have to go searching high and low before having to pay upwards of $30. I think the Prime Minister needs to rethink this seriously.
Both pharmacists and the welfare sector added their voices today to calls for the tests to be free, given the surge in cases and the change in testing regimes. The CEO of Professional Pharmacists Australia, Jill McCabe, said, "We should be protecting the health and safety of all workers and their families, not just those who can afford to buy the tests." There is also the fundamental question of why Scott Morrison is taking a different position on the free provision of these tests as opposed to other sorts of diagnostic tests. Most notably, the so-called PCR tests for COVID, done at testing hubs, are provided to the public for free, with private pathology providers getting about $85 back on each test through Medicare. In fact, a Department of Health briefing on a change in the Medicare rebate for tests, which came into effect on January 1, specifically says,
"A fundamental principle remains that no costs will be imposed on any individual requiring a COVID-19 PCR test, including necessary testing associated with relevant state and territory public health responses and border crossings."
Not only are PCR tests free to the public and will continue to be free, but a range of other public health screening tests have also always been free, such as for breast cancer and bowel cancer. In fact, 90% of pathology lab tests are bulk billed in Australia. National Cabinet is meeting tomorrow and is expected to consider a system to provide free or concessionally priced RATS tests to concession card holders and low-income earners. A number of states have also announced they are buying bulk supplies of the tests and said they will be offered for free.
We've got 500,000 rapid antigen tests that have arrived in our distribution centre. From tomorrow, we will be dispatching those across our various public testing sites.
Questions have also been asked about just why Australia is so short of the rapid antigen tests. A leaked paper from Angus Taylor's industry department, presented to business representatives on a Treasury liaison group obtained by 7:30, revealed the government had no concerns about supply issues in mid-October. Business was told that while there may be occasional shortages in early November, supply will not be a significant problem. Indications are that there are many kits already in the country and importers are ready to respond quickly to demand, the officials advised. And they said domestic manufacturing capacity was substantial. There are indeed 2 manufacturers of rat tests in Queensland alone, Illume and Antiotech. The companies sell their tests to the US and Europe. They have complained in the past about an inability to get TGA approval in Australia. Minister Taylor's office points out the departmental advice predates the discovery of the Omicron variant. A spokesperson said Minister Taylor had directed the department to do further monitoring of supply going forward. As 7:30 reported last night, the scarcity of rat tests has led to accusations of price gouging. This afternoon, the ACCC said it was aware of the significant public concern about test pricing and would be investigating after receiving more than 100 complaints.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.